What are my short term goals and how do I expect to achieve them? So, my short term goals is to become an assertive, intelligent family nurse practitioner. I plan to achieve this by mastering the electronic healthcare record of my new organization. I will maintain my education requirements and I want to um, be able to find a way where I can accurately document my patient encounters and provide evidence based care treatments with each patient encounter. Um, in my state, I need to complete a minimum of 3,000 supervised clinical hours, and that is my short term goal. To just be like establish myself as a NP. In the long term goals, I still haven't really decided if I want to pursue the clinical or the management route. I think there's certain dynamics that might influence my decision at this moment, and I am more focused on my short term goals of becoming an established nurse practitioner and finding a job where I can grow and grow as a practitioner in my clinic with the patients. What motivates me? Um, I have always worked in healthcare, so the work that we do as nurses is invaluable contribution to society. Healthcare is the safety net of society, and I feel like during the COVID-19 pandemic, to me, beyond all the scare, it gave me this big sense of purpose and the crucial importance that our roles as nurses and healthcare in general gives to society and how we really are the safety net. And it's an honor, to be honest, to be part of the healthcare industry. What does patient centered care mean for me? It's acknowledging the patient has the right to autonomy. We make shared decisions for care. It's no longer this paternalistic view that we as healthcare workers have all the answers and they're just gonna follow without inquiring, getting a second opinions, or just seeing if we are missing something and there needs to be something else for completion. So these are the patients we have nowadays. They have access to um, a lot of information. They don't have all the knowledge, but they do know how they feel. And I think patient-centered care means knowing that our patients have autonomy and that they're part of the team of making decisions for their health journey. How do you interact with families and patients? I aim to be professional with every interaction, whether it's a patient, their family members. I always try to carry myself in an open, personable demeanor, listening to their needs, and provide education and clarification and their questions or concerns. Mhm. Greatest achievement and greatest disappointment. So I think they kind of come like my greatest achievement is when I see a patient doing really well. I worked for 5 years as weekend house supervisor in a rehab center. So probably a lot of my examples and my ideas, because those were the patients that I was able to see um, for a continuous amount of time. So my greatest achievement is seeing patients doing a lot better in rehab and just gaining independence and gaining confidence and seeing them smiling again and seeing their families feeling better and having a little bit more acceptance of certain outcomes that were not ideal. Nobody likes to have a stroke. Nobody wants to have osteomyelitis. Nobody wants to fall and break a hip. But going through them in those hard moments and helping them with education, medication management, providing support for ADLs, and seeing them leaving the rehab in good spirits or better than when they came in. Um, that is my greatest achievement. Good patient outcomes. And the greatest disappointments are when you do the best that you know. Someone comes to my mind. We had a patient, 60-some-year-old male who had a history of diabetes, hypertension, hyperlipidemia. This patient was taking his Farxiga, and he had his Lantus and his Novoling, and Novolog, and we tried to teach him how to take his blood sugars and how to titrate them when they were greater than 150, how many units to give himself, to take his high dose atorvastatin, full of 40 milligrams daily every night, and take his irbesartan and be consistent with his medications. And we did in practice what we thought would make him have the best outcomes and decrease the cardiovascular risk, because we had to manage all his comorbidities. And at some point we got this DME request for a hospital bed for a whole year, and we were like, wait, like is this one person that was here like a week ago and they were doing fine, they enrolled themselves here, and now they need all this DME because they are bedbound. So you do feel like, oh my goodness, like did we miss something? Like you want to go back and see like what else could we have done to prevent the stroke from happening. And there was some comfort on the fact knowing like, hey, he was on every medication at least that we know that could have prevented it. We don't know compliance, and then we don't know life. But those are your disappointments, because you don't want bad outcomes, but they do happen. My best and worst boss. Okay, so my best boss, I have this person's in my mind, and it was someone who is supportive, someone that gives you prompt guidance, someone that is there to look up for what you're doing, what you're missing, and it's also there for looking at what you're doing right. So it not only gives you, it's not a patient, not a boss that only thanks you for what's wrong, but someone who also praises you for what's right. This person was very generous and giving prompt feedback, and you could just tell that the heart of this person was in patient outcome and not in trying to impose her power over us. And she wasn't, we could really feel that the end goal for this person was better patient outcomes and not just achieving goals so she could have a bonus. Because unfortunately, we do work, we get bonuses when certain outcomes are met, and sometimes when that is not communicated clearly, it makes you question the interest of why this person is doing what they're doing, and it makes you wonder if they're missing the big picture and if they're being patient center care, or if we're caring for other measurements that are tied to financial gains. How do I handle stress? By giving myself grace. I have noticed that I am the most stressed at a job usually early on when I'm learning new staff, I am learning the new environment, the new computer system. And there's just like this big learning curve. And I feel like that's usually when I get stressed the most. But I give myself grace and I say, hey, this is something new. You are gonna get better at it. I probably put more hours at the beginning than I do afterwards, after you become proficient in what you're doing. Um, so I think that's how I handle stress, just by telling myself there's a learning curve, you're gonna get over it, and I self encourage myself. What am I looking for in this job? This will be my first job as a nurse practitioner, so I am looking for an environment that will foster growth, where I could ask questions and I'll have a mentor to guide me. I understand that I am a licensed practitioner. I'll be a licensed practitioner with independent judgment. Um, but I particularly like this environment because I know we have access to like the referrals, where we could send the referral and share charts with specialists when there's a case that we're not exactly sure of how to proceed forward. And I appreciate that there is a team of OBs and endocrinologies, because we see a lot of diseases and diagnoses in primary care, and it needs to be worked out from the primary, but we sometimes need some support to see if we're missing something. I know we're looking for horses and then we go down the zebra's path. What constructive criticism have I received from employees in the past? I'll say that I am too focused in the learning curve, and sometimes like makes me be a little more task oriented and not being as good in customer client relationships, customer service right away. And I acknowledge, and that is true. So I think with time I have become more aware of that, and I have to like purposely relax the muscles on my face and be like, okay, smile. It's a new patient. You have to tell them, good morning, how are you doing? Let them talk. And if I'm still in the computer and doing something that it's still loading, or I'm looking for some information, verbalize that with them, and not just being quiet on my computer, ignoring them. That might be how they feel, but I'm not. So walking them through what I'm doing, and just remembering to have that conversation with the patient, so they don't feel like it's a provider, the computer, and then just having this barrier. It has happened. I have had a few new jobs, and that has been something where people said, oh, I thought you were more serious and a little bit aloft, and after I get to know you, you're a lot more warm and kinder. And it happens. Why did I choose to become a family nurse practitioner? I have dedicated 15 years of my life to nursing. Nursing, it's all I know. So I felt like pursuing the F&P role was less of a choice and more like a necessary natural progression for my professional development.